Should I get prenatal screening for my baby's health? Imagine holding your baby bump and wondering what the future holds. Deciding on prenatal screening can seem overwhelming, but understanding what it involves helps you make the right choice. Prenatal screening is a way to check if your developing baby might have certain genetic conditions or birth defects. It's important to know that screening does not give a definite answer. Instead, it shows whether your baby has a higher or lower risk for specific issues. If the screening suggests increased risk, your doctor might recommend diagnostic tests to confirm or rule out conditions. The most common conditions screened for include Down syndrome, Edwards syndrome, and Potthouse syndrome. These are chromosomal conditions that can affect your baby's development. Screening can also look for risks related to neural tube defects like spina bifida or genetic conditions such as cystic fibrosis, Tay-Sachs disease, and spinal muscular atrophy. There are different types of prenatal screening. First-trimester screening happens between 11 and 14 weeks and combines a blood test with an ultrasound that measures the back of your baby's neck. Second-trimester screening, between 16 and 24 weeks, uses a blood test called the quad screen that checks for substances in your blood to assess risk. Cell-free DNA screening, also called noninvasive prenatal testing, analyzes your blood for fetal DNA fragments. It can be done as early as 10 weeks and is very accurate, with about 99.9% accuracy for the conditions it screens. Carrier screening is a blood test that checks if you or your partner carry genes for serious single-gene conditions. It's best done before pregnancy or early on to see if both parents carry risks that could be passed to your baby. No screening test is perfect, though. Cell-free DNA screening is very sensitive, but false positives can happen, meaning the test suggests a risk when there isn't one. False positives happen about 5% of the time with serum analyte screening. False negatives are less common but possible, meaning the test shows low risk when your baby might still have a condition. That's why counseling before testing is so important to understand what results mean. If your screening shows low risk, many parents feel relieved and continue with their pregnancy confidently. If it shows increased risk, you gain time to plan further testing or prepare for your baby's arrival. Early detection helps you and your healthcare team decide on the best care, whether that's arranging for specialized delivery or connecting with specialists. It's good to remember that prenatal screening involves only a blood sample or ultrasound, so it carries no physical risk. But if you choose diagnostic tests like amniocentesis or chorionic villus sampling, there is a small risk of complications, including miscarriage, which is less than 3 in 1,000 procedures. Keep in mind that screening only looks at a limited number of conditions. A normal result doesn't guarantee your baby will be free of health issues, and sometimes screening can reveal incidental findings that need further evaluation. Before making a decision, think about what information you want and how it might influence your choices. Discuss your age, family history, and ethnic background with your healthcare provider, as these factors can affect your risk levels. Consider whether you would want diagnostic testing if screening shows increased risk, and whether you would consider options like pregnancy termination if a serious condition is confirmed. Talking with a genetic counselor or your doctor helps clarify what each test involves, its accuracy, and what results mean. Remember, screening is optional, and you have the right to decide whether to have it or not. If you choose to proceed, work closely with your healthcare team to understand your results and next steps. If the results are positive, remember that diagnostic testing can give you more definitive answers to guide your decisions. Ultimately, your choice about prenatal screening should reflect your personal values, your family's situation, and what you want to know about your baby's health. We're here to support you in making an informed decision that feels right for you and your family.